Good morning, everyone, and welcome to the Health Committee meeting. It is Wednesday, March 6th, 2024, 9:30 a.m. I am calling the meeting to order. Bear with me one moment. My mouse seems to be malfunctioning. As we gather this morning, I wish to acknowledge on behalf of committee and our community that we meet on traditional territory of the Algonquin Nation. We thank the Algonquin people and express our respect and support for their rich history. We're extremely grateful for their many and continuing displays of friendship. We thank as well all the generations of people who have been careful stewards of this land for millennia. And Ms. Chaput, has the roll been called, please?
Good morning, Chair. Yes, it has, and we do have quorum.
Thank you very much. I would invite disclosure of pecuniary interest committee, and if any, if you could identify the general nature thereof, please. I recognize none. With that, I'd seek a motion to adopt with one motion again. Mr. Kelly, I would inquire.
One motion is sufficient.
One motion. We have two separate minutes. But I would seek a motion to adopt the minutes of the committee meeting held February 17th, 2024, and the special committee meeting held February 28th, 2024, which have been heretofore circulated. Councillor Murphy, seconded by Councillor Wilmer. Any errors on or omissions on either of those minutes? None are forthcoming. All in favor? That is carried. Thank you. Item number 6 is the administration report. There was none at the time of mailing. Mr. Kelly, does that continue to hold true?
That is, I'll note that, Chair, as mentioned, I will have a bit of a report with my colleagues during a closed session that wasn't proposed on the agenda, but we do propose a closed session to talk about a piece of administrative ongoing actions.
Okay, thank you. So there is then at item 11, we do anticipate a closed meeting. There was none announced when the package was distributed.
That is correct.
Okay, thank you very much. With that then, we will go directly into the Emergency Services Department report. I'm very pleased this morning to invite our Deputy Chief, Curtis Farrell, is making his debut report. Please be kind and gracious. There is plenty of time down the road for the seasoning. With that, Deputy Chief, the floor is yours.
Thank you, Chair, and good morning, and through you, Chair, to committee. Point 1, update on community programs. Advanced care paramedics Matt Cruchet and Stuart Theron represented the community paramedic program at the Ontario Community Paramedic East Mini Expo in Kingston, where they highlighted the importance of community paramedicine in filling healthcare gaps in all of our communities. This event provided an invaluable platform for networking for all community paramedic programs across the province, and insight with over 200 healthcare leaders and various sectors across Eastern Ontario. Provide a little bit of a snapshot of what's currently occurring at the RCVTAC desk activity. You can see that we've had 353 encounters. The desk paramedic completed a clinical assessment over 190 times, with 209 encounters were resolved by that paramedic on the desk. 78% of these activities were with existing patients. Pembroke, Renfrew, and Arnprior are our most active sites. 50% of the encounters take between 5 and 20 minutes to manage. The remaining 25 can take less than 5, and the final 25% take more than 20 minutes. Primary reasons, we're looking at care plan management, system navigation, then rounding off with clinical interventions and health concerns or advice. In mental health training, community paramedics were invited to the Algonquins of Pikwakanagan First Nation for an extensive third-party mental health training session led by the Algonquins of Pikwakanagan First Nation mental health team. This specialize in training equipped practitioners with enhancing their skill and knowledge to engage and align with the relevant local and broader knowledge and initiatives with our Indigenous population and the Indigenous Health Circle. Shareholder meetings and training sessions are MESA. Community paramedics are engaging in meetings with shareholders at a Grind in Pembroke to discuss the creation of a comprehensive plan to provide support and resources for the precariously housed and the mental health population in Renfrew County. Recognizing the importance of leveraging existing programs and services in a team-based approach to address identified barriers and challenges to safety and well-being, and building a communication strategy platform to align with the MESA strategy. In addition to these meetings, the community paramedics, in collaboration with public health, conducted CPR and naloxone training for the volunteers working with these vulnerable populations to enhance community safety and response in critical situations. All of these initiatives enhance the strategic goal number 3 of community wellness and healthcare. The 911 operational update. We've seen an ongoing benefit from the implementation of the additional 24 hours of paramedic coverage that began back in July of 2023. We've seen a decrease in operational staff end of shift overtime and the corresponding reduction in meal claim costs. Improved workload distribution across the paramedic units has resulted in increased availability of emergency response with a more consistent geographic spread of the available units. With our initiative of placing a commander in dispatch, this presence of a paramedic service commander in the Ministry of Health Renfrew Communications Center has led to a marked increase in situational awareness for our operations. As a result, we have enhanced deployment of our 911 paramedic units, enhanced and improved coordination of our specialty Sierra team, and activation of our peer support team. This also leads to an optimizing use of our emergency response units and our operational commanders to provide a much more robust and timely response. With impending implementation of the medical priority dispatch system at the Renfrew Central Ambulance Communications Center, there have been significant planning and deployment related sessions over the past year. There will be public information about the changes in the dispatch center and what the community can expect when they call 911 and the type of questions that they're going to receive from the dispatchers. There will be some community information coming shortly from the ministry. We certainly would like to thank our partners at the Communications Center for establishing a team-based approach to the deployment or development of the paramedic resources. There have been many anecdotal experiences already documented, both clinical and operational in nature. We're collating all of these for a future presentation to the committee. So we're very thankful for their collaborative approach with us on this, the position of our commander in their CAC center. Moving to
Actually, I'll pause there briefly. Thank you very much, Deputy Chief. Just at the end of the information items, we'll review those before we get into the bylaws. And with that committee, any questions or comments on, and there are several components of information item number 1. I am having a flashback to our actual COVID reporting where there was one number and about 5 subheadings. Any question or comment, committee, on any of the items within the community programs? I see none. Moving on then to item 2, the operations update. I see none. I'm very pleased, actually, that this is moving forward. I'm sure committee will recall that we were very fortunate that Renfrew County was part of the first tranche, I guess, of the region's areas, the communication centers for the rollout of this new algorithm. One of the recurring themes of the paramedic service, right help at the right place at the right time. And this is anticipated to go a long way towards that and have the added benefit, bonus, that perhaps it is going to turn the heat down on some long-standing irritants that we've had with respect to out-of-region response, et cetera. So I'm very pleased that we have been part of this up front and at the rollout and that it is progressing. With that then, if there are no further questions, the floor is back to you, Deputy Chief.
Thank you, Chair, and through you to committee. Bylaw emergency management funding. So the recommendation is that Health Committee recommends that County Council adopt a bylaw to accept the Community Emergency Preparedness Grant transfer payment agreement that outlines the approved funding for the required actions, and that is to receive $49,600 in support of emergency preparedness in the County of Renfrew, and that the Finance Committee be so advised.
Thank you so much. I would now seek a mover, please. Councillor Weir, seconded by Councillor Grills. The background, please, Deputy Chief.
Thank you, Chair, and through you. Attached appendix, ES1 is a letter of approval. It contains funding conditions from Ms. Rudy Nair, Senior Manager, Design and Implementation Unit of the Emergency Management Ontario. This confirming the funding and providing the terms from the Community Emergency Preparedness Grant Program in the amount of $49,600 in support of emergency preparedness in the County of Renfrew. The agreement for this funding was previously circulated to Council. This initiative supports strategic goal number 6 of environmental resiliency.
Thank you very much once again, Deputy Chief Farrell. Committee, any questions or comments? Of course, this is actually formalizing the information that we received just last week at Council as the addendum. Very pleased and thankful to the ministry. I think that we're going to leverage an enhanced value from the just under 50,000. I think the value that's going to be returned to our community will be substantially in excess of that. If there's nothing more, all in favor? That is carried. Thank you. And once again, item 4, please, Deputy Chief.
Thank you, Chair, and through you to Council. The 2023-24, 2025-26 Community Paramedic Website and Education Agreement. The recommendation is that the Health Committee recommends that County Council adopt a bylaw authorizing the Warden and Clerk to sign an agreement with the Ontario Health for the development of a community paramedicine website in consultation with industry partners.
Thank you. Once again, I'm seeking a mover and seconder. Moved by Councillor Murphy, seconded by Councillor Nicholson. Once again, background, please.
Thank you, Chair, and through you to committee. The Ontario Health will be providing funding to the County of Renfrew to develop a community paramedicine website. This is in consultation with industry partners, including migrating the current community paramedic secretariat domain and establishing an online knowledge translation tool for community paramedicine programs across the province and partner organizations. The agreement and its corresponding schedules are attached in Appendix 2 through 7.
Thank you very much. Once again, committee, I will open the floor to any comments or questions. Seeing none, all in favor? That is carried. I'd now seek a motion to accept the Emergency Services Report as a whole, please. Warden Emo, seconded by Councillor Wilmer. A further and final opportunity, committee, for any questions, comments on any of the 4 items. Seeing none, all in favor? That is carried. Thank you. Oh, and that is a shame. We're 30 seconds short of or over record time. Deputy Chief, what an auspicious debut. Thank you very much for that.
You'll be invited back.
Moving on. Moving on. I'm going to have to get the hammer. Mr. Blackmore, if you would be so kind as to take us through the long-term care report.
Thank you, Chair Donahue. Through you to committee. Good morning, everyone. Item number 1 on page 43 of the report. It summarizes a Ministry of Long-Term Care inspection at Bonnechere Manor over a period of 7 days, ending January 17th, with 3 written notifications being issued. The link is contained within the report action plans have been created and actioned. Item number 2 is an update on the butterfly approach at Miramichi Lodge. Pleased to advise that we underwent our certification audit, and by all accounts, all went very well. Very impressed with our environment and the staff. We await our official certification response sometime within the next 4 weeks. So we're very much looking forward to that.
We'll likewise, Mr. Blackmore, at the information items, will take a brief pause. Committee, any questions or comments on item number 1, the inspection reports? I will reiterate, of course, everyone is quite aware of the impact of COVID in long-term care from 2020 through, I will say, 2023. And the regime for inspections has certainly been heightened. I'm not entirely sure that the approach is sound that has been taken. I will reiterate what we have heard in this room. I anticipate that we are likely to hear of inspection reports almost on a monthly basis. In my time chairing health, I think maybe there was 6 occasions. I don't think it's been double digits of the number of inspections reports pre-COVID, but the regime certainly has been changed, and it is addressing some challenges within long-term care. But I think we need to monitor this very carefully to ensure that the allocation of enforcement is the appropriate allocation of resources rather than support for care and support workers as well in long-term care. If there are no questions, back to you then, Mr. Blackmore. Oh, no, sorry, the butterfly approach. I am remiss. Any questions or comments on item 2? Mr. Kelly.
No, thank you, Chair. I thought I'd just take a moment. Now, we don't have the outcomes, and I don't want to presuppose anything happening, but this is a big step, and just want to congratulate on behalf of the County of Renfrew staff to Mr. Blackmore and his team. I believe it was January of 2020 when Minister Fullerton was here and launched it, if you recall, after I think it was during, well, it must have been 2019 when a group of yourselves, elected officials, went down and toured Malton Village, and brought this idea back from previous former director Shelley Sheedy. So obviously the pandemic had a big part to play in pausing the launch of this, but much work was being done behind the scenes. So again, this is going to be great as it works its way through Bonnechere Manor and Miramichi Lodge over the next few years. So again, congratulations to Mr. Blackmore and his team.
Thank you so much, Mr. Kennedy. Of course, I will echo your comments. I believe it was October of 2019. Then Warden Murphy and myself and quite a number of staff, including the director then, Ms. Sheedy, did travel to Malton Village. And it was a curious experience, and I know it was a very emotional experience as well, to see the emotions-based or feelings-based level of care rather than a regimented, at this hour the beds shall be made, et cetera, et cetera. However, the thing that stayed with me on the return trip from there, how it seemed so obvious, so many of the things that were part of the butterfly approach, and yet they were invisible to us until you actually witness them. So certainly echoing Mr. Kelly's comments. Unfortunately, COVID has interfered with what was the anticipated rollout of Butterfly at both Miramichi and Bonnechere Manor, but very pleased that both are continuing to advance. Back to you, Mr. Blackmore.
Thank you, Chair Donahue. Number 3 is a resolution for quality improvement plan approval. A recommendation that the Health Committee recommends that County Council authorize the Warden, Chief Administrative Officer, and the Director of Long-Term Care to sign and submit the quality improvement plans for Bonnechere Manor and Miramichi Lodge and submit to Health Quality Ontario before the March 31, 2024 deadline.
Thank you. I now once again seek a motion, please. Councillor Wilmer, seconded by Councillor Grills. Background, Mr. Blackmore.
Thank you, Chair. As background, Ontario Health, Ministry of Health, and the Ministry of Long-Term Care continue to align quality improvement efforts to better reflect current priorities and health system changes, and requires the submission of an annual quality improvement plan. A QIP is a formal documented set of commitments that a healthcare organization makes to its residents, staff, and the community to improve quality through focused targets and actions. QIPs are used in many sectors to assist organizations delivering quality programs and services. Ontario Health defines the priority indicators and populates the relevant data through the annual resident satisfaction survey and the resident assessment instrument minimum data set, RIMDS. The Director of Long-Term Care will overview the draft. Well, I'll give just a brief overview, if I may, if the committee will indulge me in a brief 6-slide PowerPoint presentation to sum up what is a approximately almost 20-some pages of QIP.
Absolutely.
If you could just bear with me as I share my screen.
The excitement is building.
Okay. This is not going as planned. Here we go. I'm almost there.
There we are. Do carry on, Mr. Black.
Thank you so much. So here we go. I just want at the outset just to give thanks to Tricia Michaelis, Director of Care for Monastery Manor, and Nancy Lemire, Director of Care for Miramichi Lodge, the authors of the QIPs for both homes. So I just put my slides together, essentially combining, because for the most part, the indicators we chose to address, priority indicators, are similar for both homes. So number one being the number of emergency department visits for modified list of ambulatory care sensitive conditions, which include epilepsy, lower respiratory, asthma, diabetes, heart failure, and pulmonary edema, hypertension, and angina are the conditions that we're looking at. So the current provincial average to avoid those types of admissions to hospitals is 18.1%. And we've been running historically below that provincial average for a number of years, in large part due to the registered staff and certainly our nurse practitioners, for which we're now very fortunate to have one at each home. So this past year, we're running at about 12% for Monastery Manor and 11% for Miramichi Lodge. So the target is to, for the Manor, remain at 12% or lower. For the Lodge, 8%, and you might identify, well, why are there separate goals? Just keeping in mind that each home has its own quality improvement committee consisting of staff, medical director, representation from family council, resident council, so there might be a slight variation. But for the most part, plans to continued improvement, I've grouped together which is for the most part similar. So we're going to continue comprehensive assessment and reporting to the nurse practitioner for symptoms of treatable conditions. And the nurse practitioner as the lead is to respond to acute changes in resident condition. In collaboration with the resident and their substitute decision maker, interdisciplinary care teams ensure documentation of accurate goals of care specific to palliation or those decisions whereby a loved one may decide that a transfer to hospital in their mind would perhaps be warranted when, with some education with regard to the services the home is able to provide, we may find that service is provided at the home. And of course, continued analysis of quarterly statistics, flagging potential unnecessary transfers. This is led by the nurse practitioner with review with nursing staff. And a continuation of our continuing to enhance our palliative care program. The next indicator is the percentage of staff who have completed relevant equity, diversity, inclusion, and anti-racism education. So both homes for a number of years now have had a baseline education platform delivery with regard to EDIAR education through what's called our Surge electronic learning platform. So we're looking to expand upon that, given that it was not something that was identified as a priority indicator at the provincial level, but now it is. So we're going to take what we're already doing and expand upon it to include some work from our nurse practitioners to enhance 2S LGBTQI and health equity education guidance per the Registered Nurses of Ontario best practice guidelines. In addition to that, as members of the Ottawa Valley Ontario Health Team, that's one of the priority goals for the QUIP for the health team this year as well, is to build a piece for ensuring that the equity, diversity, inclusion, and anti-racism is covered as a priority action item for the QUIP. So we'll glean what we can from that participation as well. The next indicator is the percentages of residents who fell during 30 days preceding their assessment. Provincial average is right at 16.5%. Currently, Bonnechere Manor is at 17.5%, and the Miramichi Lodge is at 16.98%. So we're both attempting to be at or below the provincial average. Important to keep in mind with falls, though, is falls, we want to prevent falls where we can, but they're also indicative of maybe perhaps a person that's is mobile, and we want to respect the dignity of risk when we're looking at potentials for falls. I think probably most importantly, we want to avoid injury where there is a fall. And there's a correlation between falls and restraints as well. And currently both Miramichi Lodge and Bonnechere Manor are running near 0% physical restraints, an indicator tracked by the province, and we've been doing that for a number of years as well. So just realizing that we basically have virtually no residents that are physically restrained, that tends to mean that they're up and perhaps more mobile and may be more susceptible to falls. So we're going to continue education for registered staff regarding falls prevention in accordance to best practice guidelines. We have what's called high-risk rounds and incidence huddles at the time of fall to examine what it is we can do at the time of the fall to prevent it from happening again. And we also take those statistics and review them quarterly through our quality improvement committee meetings looking for trends. Number 4 indicator is the percentage of residents who were given an antipsychotic medication without diagnosis of psychosis in the 7 days preceding their assessment. Provincial average is 19.3. Bonnechere Manor currently running at 22.94, and Miramichi Lodge is running at 16.73. So that's something we're obviously trying to get below the provincial average. We continue. We have a focused medication review conducted by our medical directors and nurse practitioners. And when we meet for our quality improvement committee meetings on a quarterly basis, that's has been for a number of years, one of our primary focuses to identify, okay, who is this individual taking this medication, working with the geriatric mental health team, Behaviour Supports Ontario, and identifying all of the potential interventions we could use that are don't involve a medication. So it's always been our last resort. So we've been below and we just kind of creeped above, so we're trying to get it back down again at the Manor. And currently at the Lodge, we're running below the provincial average. The last indicator is unique to Bonnechere Manor in that it's the percentage of residents with a pressure ulcer that worsened to a stage 2, 3, or 4. So essentially it worsened from perhaps a stage 1, you have some redness and there's no break in skin. When you get into a stage 2, there's a break in skin. 3, you're perhaps down to the epidermis. 4, perhaps is so much as being bones or tendons exposed. So sometimes we inherit these wounds when they're admitted from either community or hospital. Our job is to make sure that whatever it is we inherit, it doesn't get worse, or if there's no pressure ulcer we want to prevent it from happening at all. So at Manor right now, we're running at a 5.1%, and we're trying to get down to a 2. We've also found that there's some ambiguity there with regard to coding, staging the wound. If an RN were to come in and identify, oh, I think this is a stage 2, and it's close, and the next time it's staged, that same wound, maybe it didn't get much worse, but it get staged as a 3, was a worsened It would show up as an indicator here. So we're working with our staff to make sure we're all very consistent with regard to our staging. And keeping in mind, too, it doesn't take much for it to drive up the percentage amount. We could be talking about one resident that results in such a significant swing because there's such an overall low prevalence of pressure ulcers to begin with. So we're going to continue a staff education with an emphasis on accurate staging and documentation of the stage, and to be optimized for wound product or wound type. We're going to expand the use of photographic documentation and wound measurement to all wounds to aid monitoring and comparison. And we're going to expand preventative skin integrity education to personal support worker staff. So yeah, those are the things we're doing to get ourselves back down to that below fringe average. And again, that could mean a change in 1 or 2 residents to bring us down to that level. And that concludes the show.
Okay, thank you very much, Mr. Blackmore. Committee, so we are on item 3, the quality improvement plans resolutions. Any questions or comments? Warden Emo.
Thank you. I know through sitting in meetings with the Warden's Caucus and with Roman Amo, some of the discussion for representatives of long-term care has been that they struggle to keep standards or improve standards or use education because of the agency workers that we're in the position of having to use. Is that an area that causes those numbers to go up because of the constant changing of staff as opposed to a steady workforce?
Mr. Blackmore, please.
Thank you, Chair. To Warden. There's potential for that. Our registered staff, there are fewer of them in terms of those that are working at the manor right now. For the most part, we have a wound care team that are regular staff versus agency staff. So that that could be a factor, but for the most part, like our committee members that manage skin and wound. It's potential. It's something I'll have to look into.
Follow-up, Warden?
Yeah, thank you. Thank you. There's been a lot of conversations at dinner about that, and so that was one of the first things I thought of. So, I'm just raising, and I'm glad you're going to take it into consideration. Thank you.
Thank you. Any further questions or comments? Councillor Nicholson, please.
Thank you, Chair. I was just seeing if I could get the presentation put back on. I didn't, sorry. Yeah, once it's on, that's fine.
Does nobody else do screen grabs? Do you remember the sequence, Mr. Blackmore? You don't want to cut the red wire. Outstanding, thank you. And was there a particular page, please, Councillor Nicholson?
I'm going to have to, I didn't write it down, so I
Scroll
apologize.
through that, please.
Scroll first.
Do you know which of the quality improvement points it was relating to?
I think it's the third slide here. One more.
Falls?
Yes, for falls.
For falls.
Falls, and then the fourth one. So third and fourth points. Question here is just, I know that the OHT has got a falls program. I just pulled it up here from a falls pathway proposal for participation. Do we incorporate from a long-term care perspective, and will that help us achieve this QIP objective?
Mr. Blackmore, please.
Thank you, Chair. To Councillor Nicholson. I expect we use best practice guidelines that are focused on long-term care versus what you might find in the community, like fitting up a person's apartment to prevent falls. We certainly look at all of those environmental factors within like the residence room. to the point of, making sure that there's no trip hazards and proper footwear, and we use alarms and such to alert us when someone that's prone to a fall might be getting up in the middle of the night. So I think we don't use that community tool, but we use a number of other best practice tools geared for long-term care.
Follow-up, Councillor Nicholson?
Thank you. That's perfect. I appreciate the education in that part. And the fourth item, next slide, please. So this one, I just was wondering why the percentages are so different between the two long-term care homes? Is it just based on the population at the time that this was assessed?
Mr. Blackmore, please.
Chair, through you to Councillor Nicholson. Yeah, there's variation. Like I said, the manor had been below. It varies largely on the individuals that are currently placed or residing at the home. And sometimes it's coding. We found one time when we were like unusually high, we found it was a coding error on behalf of the person that was doing the MBS assessments. So sometimes there's that as a factor. But they're not all that far apart in over trend-wise. At this moment in time, they are, but trend-wise, they're not pretty close.
Follow-up, Councillor Nicholson.
Thank you, Chair. And it leads to my next question, which is that the 19 versus the 15, having a different objective for each one of the two homes, is that purely based on where your start state is, or is there some other factor?
Through
Once again,
Chair,
Mr. Blackmore,
Councillor.
please.
So these quality improvement plans are a continuation of our quality improvement committees, for which there's a varied makeup at each home. So there's different medical directors, there's different family council representation, resident council representation. So there's slight variations, but ultimately our goal is always to get below the provincial average.
Thank you. Any further questions or comments? I just had one actually prompted from the dialogue with Councillor Nicholson's questions. So the data points that are on here in terms of current performance, are those point in time, or are those annualized?
Chair, through you to committee, they're a little of both. They're point in time, but they're based on a floating year. So it's at that point in time for the previous year.
Okay. Okay.
It'll change again on a quarterly basis. We drop a quarter, we add a quarter.
Okay, so there is somewhat of a smoothing or a global average, if you will. Okay, thank you. That was what I was curious of. If there's nothing further, I will call the question. All in favor? That is carried. Thank you. And Mr. Blackmore, on to item number 4, the smoking policy, please.
Thank you, Chair. Through to committee, item 4 is a recommendation concerning the County of Renfrew bylaw 84-09 concerning resident smoking on county long-term care homes property. A recommendation that the Health Committee recommends to County Council that policy G009 smoking regulations for the County of Renfrew long-term care homes, Monetary Manor and Miramichi Lodge remain applicable, permitting residents of Monetary Manor and Miramichi Lodge to smoke on the properties in designated outdoor smoking areas.
Thank you. I'd seek a mover, please. Councillor Weir, seconded by Councillor Murphy. Background, Mr. Blackmore.
Thank you, Chair. As background, March 1, 2023, County Council supported the revision to the long-term care homes policy G009 smoking regulations, removing residents of Monetary Manor and Miramichi Lodge from the policy, permitting residents to smoke on the property no closer than 9 meters from the entrance to each home in compliance with the Smoke-Free Ontario Act 2017. After reviewing the smoking practices at both homes over the past year, each home has noted an increase in applicants who smoke seeking placement. At times, this presents as a challenge where a resident no longer able to smoke independently in a safe manner requires smoking cessation and is unwilling to do so. Notwithstanding, the rationale to permit residents smoking on home grounds as a means to mitigate potential injury associated with vacating each of the home's properties remains germane. Staff is requesting that the County of Renfrew long-term care homes policy G009 smoking regulations remain applicable until such time a reassessment may be warranted.
Thank you, Mr. Blackmore. As committee will recall, we had changed the policy with not particularly sunsetting clauses, but with an expectation of policy review. That is what's before us here. Any questions or comments? Councillor Nicholson, please.
Thank you, Chair. I'm very supportive of the proposal. My question just is with respect to cessation supports, and they'll continue, I'm assuming. I'm just curious, how are those offered to the, how is that resource available to the residents in our long-term care facilities?
Mr. Blackmore, please.
Thank you, Chair, to the councillor. So they're available through our any one of our physicians and our nurse practitioner, supported by registered nursing staff.
Thank you. Any further questions or comments? Seeing none, all in favor? That is carried. Thank you. And I think a final item is item number 5. Yeah, Mr. Blackmore, item 5, please.
Thank you, Chair. Through the committee, item number 5 seeks a bylaw authorizing a funding agreement with the Ontario Health East utilizing the Local Priorities Fund. A recommendation that the Health Committee recommends that County Council adopt a bylaw authorizing the Warden and Clerk to sign the 2023-24 Local Priorities Fund Batch 3 agreement for specialized equipment associated with IV and wound care in the amount of $47,100 with Ontario Health, and further that the Finance and Administration Committee be so advised.
A mover and a seconder, please. Councillor Wilmer, seconded by Councillor Grills. Unfamiliar with charades, unfortunately. Mr. Blackmore, background, please.
Thank you, Chair. Background: Ontario Health through Ontario Health East advised the Corporation of the County of Renfrew, Miramichi Lodge will receive one-time funding in the amount of $47,100 in the fiscal year 23-24 to support the purchase of specialized equipment and/or associated training for IV care and wound care that commonly lead to avoidable emergency department visits. The agreement is attached as Appendix LTC 2.
Thank you. I was remiss. I had been indication. Of course, we do have an addendum for today with respect to respite care beds. On the item before us, though, any questions or comments? Seeing none, all in favor? That is carried. Thank you. And there is an item 6. It is contained within the addendum. Mr. Blackmore, I will yield the floor once again to you.
Thank you, Chair, through the committee. Item number 6 is a bylaw regarding short stay beds at Miramichi Lodge. A recommendation that the Health Committee recommends the County Council adopt a bylaw authorizing the Warden and Clerk to sign the 2024 short stay respite care beds agreement with Ontario Health for the operation of 2 short stay respite care beds at Miramichi Lodge effective January 1, 2024 to December 31, 2024.
Thank you. Once again, seek a mover, please. Warden Emo, seconded by Councillor Nicholson. Mr. Blackmore, background.
As background, as reported to committee in January, Miramichi Lodge agreed to operate 2 short-stay respite care beds in 2024. Ontario Health, through the Ontario Health East, informed Miramichi Lodge on March 1, 2024, the approval to operate 2 short-stay respite care beds is effective January 1, 2024 to December 31, 2024. The agreement is attached as Appendix LTC 1. Ontario Health, through the Ontario Health East, advised that Bonnechere Manor's 2 short-stay respite care beds will be discontinued in 2024 and that the beds will be converted to long-stay beds. Bonnechere Manor will consider the reopening of the 2 short-stay beds in 2025 if staffing complements permit.
Thank you, Mr. Blackmore. Questions, comments, committee? With respect to the main thrust of this resolution, the final paragraph is not germane specifically to Miramichi Lodge, but I'm just kind of curious at the manner where pre-COVID there were respite beds at each home, and I know that in the COVID response we were unable to do that, and even in the follow-on, and I'm just kind of curious if the assignment as long stay of what formerly pre-COVID had been short stay, is that simply because of the enduring COVID challenges, and is there an expectation to reestablish respite care beds in the future?
Chair, through you to committee, that is our hope, that we will be able to reestablish respite care beds in 2025. The challenge lied primarily with the staffing in terms of respite is rather resource intensive with the frequency of admission and discharge versus long stay beds for which when a resident comes in, they're in for the year typically, at least. So just the paucity of the reliance rather on agency registered staff and the challenges with staffing at the moment, just it's resource-wise, it just wasn't the time for us this year.
Okay, thank you for this. So the continuing impact of health human resource is driving this question, because the reason that it does bear some scrutiny is that I think that the respite care beds within both of the long-term care homes have been essential in our community for those who are receiving care outside of the long-term care residences, that there is that interregnum, that period where there is the support that can be provided through the county home. So I do look forward to finding some stability, ever elusive, I think, from the time that I've sat in this chair, but that we do find some stability in our staffing resource and are able once again to offer this vital service in our communities. In any event, thank you for that. Any other questions or comments? Seeing none, all in favor? That is carried. I would now seek a motion to accept the long-term care report as a whole, please. Warden Emo, Councillor Murphy. Once again, committee, a final opportunity for questions on any aspect of the long-term care report. Seeing none, all in favor? That is carried. Thank you. We do have Board of Health minutes from the January 30th, 2024 attached. I'd seek a motion, I believe, to receive those. Mr. Kelly is nodding. That is correct. Could I have a motion to receive those, please? Councillor Grill, seconded by Warden Emo. Any questions or comments on the minutes? We do have 3 members of the Board of Health present here today. Hopefully, if there are any questions, they are able to address them. Any questions or comments? There's kind of a circular firing squad.
So we're just pointing out who would answer the question.
We've chosen the vice chair.
Okay, so we've established who shall be the spokesperson in the event there are questions, which I have no indication of at this point. Just want to have clarity.
Democratic process.
Thank you. I do really appreciate the forward-looking aspect of it.
And it was unanimous.
I will now seek, and I almost feel compelled to come up with a question after that. Committee, have you any questions or comments on the minutes of the Board of Health from January 30th? Notwithstanding that very forward-looking endeavor, there are none, but thank you nonetheless to all members. All in favor? That is carried. As new business, and I am quite remiss in this, and I do apologize, and thank you to Ms. Dombrowski. This is, of course, International Women's Week, and I should have made note of that at the outset of our meeting. In celebration of International Women's Week, I want to acknowledge and honor the incredible achievements, resilience, and contribution of women throughout the county of Renfrew, of course, in particular, those who roll up through this committee. Let us continue to strive for gender equality, empowerment, and support for all women. Together, we can create a more inclusive and equal community, and it is important to make note of this. And in fact, each week should be Women's Week if we are to truly speak of equality. And thank you once again, Ms. Dombrowski, for reminding me I was remiss in not making note of that. Any new business? I see none. As we had identified at the outset of today's meeting, there is in fact a need for a closed session. I would now seek a motion to move into a closed session. This would be regarding Section 239 something.
Section 239 2C, a pending or proposed acquisition of or disposition of land by the municipality.
And I hope you all appreciate my ventriloquism skills. With that, a mover, please. Councillor Grill, seconded by Councillor Wilmer. All in favor? That is carried. We are in closed. All ashore what's going ashore. Thank you, everyone, for your patience. We are now at item 12. The date of the next meeting shall be Wednesday, April 10th, 2024. I'd seek now a motion to adjourn, please. Councillor Wilmer, Councillor Weir, all in favor. We are adjourned. Thank you so much for everyone's patience and for your attention to this today's agenda. Have a good day.